are going to discuss about suctioning procedure. So in that, we have to see suction machine, what is the meaning of suctioning, what is the parts of the suction machine, what are the types are there, when we have to do suctioning, and what is the procedure for suctioning. That everything now I am going to discuss. First, we start with suction machine. What is the meaning? Suction machine are applicants that are used to remove substance such as the blood, saliva, mucus, and vomit from the person airway. Airway means respiratory system. If anything accumulated, that means such as blood, saliva, mucus, or vomit. Anything accumulated in the body, how to remove? Through suction machine we can remove. And second one is, what is the meaning of suctioning? It is a procedure that remove excessive secretion from the mouth and throat. That means oropharynx. Oro means mouth and throat means pharynx. Oropharynx. In that place, any collection is there, we can use suctioning. And second, nasopharynx. Naso means nose, pharynx means throat. In that pathway, any collection is there, we can use suctioning. And windpipe. Windpipe means nothing but trachea. In that trachea part, anything collection is there, we can use suctioning procedure. So it is the suction machine, it's a device. It's one type of the device. Through that device, we can do the suctioning in this area. Now we can see this is the machine, suction machine. This machine mostly using operation theater. When during the surgery, they will cut the skin, they will cut the muscle. In that, during operation time, maybe the blood will come, is collected into the particular area. So how to remove? Through this machine, we can do the suctioning, we can remove the material. Next, indication of for suctioning. What are the indication? Need to remove retain secretion. That means any secretion inside the body we can remove. Next, need to maintain patency of the airway. That means we have to maintain the pathway, respiratory pathway clearly. Maintain patency of airway. To treat atelotasis, that means any congestion is there, we have to remove from the respiratory tract. To obtain of the sputum specimen, that means if patient is having any lab investigation, doctor is advised sputum specimen. We have to use suction and we have to collect from the container. This is the indication for suctioning. Need to remove retained secretion, need to maintain patency of airway, to treat atelotasis, to obtain of a sputum specimen. Next, what is suctioning? It is for the endotracheal tube. Endotracheal tube, ET suctioning. ET suctioning, how to do? What is the meaning? Endotracheal suctioning is the removal of secretion from the tracheobronchial tree through an ET tube, endotracheal tube, with the help of the mechanical suction device. So here the patient is already intubated. After intubation means we are inserting endotracheal tube. So patient is unconscious, semi-conscious, they can't able to breathe, especially operation time, they are using the endotracheal tube. This endotracheal tube connected to the ventilator. This ventilator is giving the artificial breathing. So if anything secretion happen in this tracheal part, so they are doing suctioning. Next one is type of ET suctioning. That means endotracheal suctioning. One is open suctioning. Next one is closed suction. So the open suction is single use. One time use, we can throw it. The closed suction, we cannot throw it. We can use again and again some particular days, or 2 days, after 2 days or 3 days once we can change this one. So types of suctioning, two. First one is open suction. In that open suction, we are using suction catheter. Closed suction means that suction catheter is attached to the endotracheal tube. Whenever we want to use suctioning, through this tube we can use and we can remove. But open suction, one disadvantage means we have to use one time, then we have to throw it. So this is type of the closed suction method. The patient is intubated, that means endotracheal tube inserted. That tube is connected to the ventilator, the white two branches. This tube is ventilator circuit. That circuit is connected to the ventilator machine. Ventilator machine means that machine is giving artificial breathing.
Next we will see when we have to do the suction. Suctioning is done only for the patient who cannot clear their own airway. If the patient is not able to take own breath, like a semi-conscious, unconscious patient, they are attached with the ventilator, that time we have to do the suctioning. Its timing should be tailored to each patient rather than performed on a set scheduled. Means we have to do the suctioning according to the patient condition, not for the schedule. Start with a complete assessment. We have to do the complete assessment for the patient. Then only we can know the patient needs suction or not. Finding that suggest the need of the suctioning include. So we have to do the findings when the need of suctioning to the patient. Increased work of breathing, that means the patient is having tachypnea, so we have to do the suction, then only we can decrease the breathing of the patient. Changes in the respiratory rate, the same like before. Any changes in the respiratory rate, maybe the patient is having more congestion in the lungs, so they cannot able to take the breath, so the tachypnea will occur. So when we are doing the suctioning, we can reduce the respiratory rate. So these are all very important points. As a nurse, we have to deal with the patient. We have to remember before doing suctioning. Next, we move on to the procedure for the suctioning. So here we have to remember some points. The first one is place patient in semi-fowler position. So we have to make the patient semi-fowler. Why means we have to prevent aspiration to the patient. If you are making the supine position, maybe the aspiration will occur. So we have to make the patient semi-fowler position. This is the first point. Our second important point is select appropriate sized suction catheter. We have many sized suction catheter. If the patient is pediatric, we have to take the small size. If the patient is adult, we have to take the big sizes. So select appropriate sized suction catheter. Our third point is hyperoxygenate before each suction pass. That means before doing suctioning, we have to provide pre-oxygen. Because why we are giving pre-oxygen means once we are doing suction, we are taking all the oxygen from the lungs. The patient lungs will be collapsed. That's why we are giving pre-oxygen to support the lungs. The next point is insert catheter to the pre-measured depth. Don't go too much depth. We have to go minimum depth only. Apply suction on withdrawal of the catheter. Once we are introducing the catheter, when we are removing withdrawal, we have to take very slowly. Don't take very forcefully and vigorously. We have to make the gentle insert and gentle removal. The next one is limit suctioning to 5 seconds. Don't do suctioning more than 5 seconds. We have to do the limit suctioning up to 5 seconds. That's enough. Next, use suction pressure between 80 to 120 mm of Hg. So these are all the things we have to remember when we are doing the suctioning.